Okay. I have been hearing all the frustration Akshay was doing.
The sound is not good, Dilipji.
The sound is distorted.
Okay, just one second. That's what I thought. Open microphone. Let me get into an open microphone.
Okay.
It just started doing it this.
The instrument might have gone some issue.
Okay, can you hear me now?
Yes, very good. Very
Okay,
good.
hear me good? Okay.
Yes.
And okay. Yeah, I was having a little problem with my AirPod Pro, but I'll be doing little in the back, you'll be able to hear me. What I was saying, that I was hearing all this intellectual conversation, and it was just too much for me, because I'm a very simple person. I only follow one principle, and the principle is called Karo Yog Rahane Rog. So I'm going to show you how to practice yoga. I get a lot of comments, questions here. I cannot bend my right leg. I cannot turn it. I cannot do it. I cannot do these asanas. I cannot do it. The pranayam is good. Why you have to do pranayama first, asana first, meditation first? I think these are all guidance, but for me, wake up in the morning, do my little rituals, keep doing yoga for the whole day. Okay, I'm going to show you how you start doing a yoga practice. And before that, there are a lot of people here ask me one good question about the concept of yoga as a therapy. Remember one thing, the practice of yoga, what we do is a philosophy, Yoga Sutra of Patanjali, 196 sutras, of which 193 is to quiet down your mind. Practice we do, Patanjali Ashtanga Yoga, Yam, Niyam, Asana, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. And yoga therapy is adaptation of these practices based on our individual need. That is the pure basis of starting a yoga practice. So, and let me go over with you again and again. You have a structural problem. You have a back pain, you have a arthritis of your knee, arthritis of your hip. We'll start a very slow staged asana practice, and we'll use our breath to create a relaxation so we can progress to a full stages of the asanas. It might take some time. It varies from person to person. I have a person who came and said, I did a headstand in 3 days. And I know one of the world famous yoga teacher tells me, it took me 10 years to learn how to do a headstand. I have a respiratory problem. I have an asthma. I have a COPD. I have a pulmonary fibrosis. I sit down in my spine straight. Slowly and slowly, I start doing a little pranayama practice. I have a neuropsychiatric disorders. I have a depression, dementia. Kim asked me the question about dementia. We'll start a little bit probably with the meditation practice first. So able to learn how to use all the 8 limbs of the components and also the yoga philosophy is the basis of learning the yoga practice. So first practice, how do you learn? How do you learn? You learn able to sit down with your spine straight. So if you're like me, if you have a kneeling stool, you all wanted to see a kneeling stool. Let me show it to you what a kneeling stool looks like. This is a kneeling stool. This is a kneeling stool. I have a little quill in it, so you'll be able to see it. You sit down in a kneeling stool, put your knee here. Your spine will never bend. You will never able to do this. You're never able to hunch yourself. You have to keep your spine straight. The bottom line of your yoga practice. Sanskrit word, Merudanda Achal, Manasthi. When Merudanda becomes Achal, your mind quiets down. That is the pure practice of Vajrasana. When you do a Vajrasana, it's a powerful relaxing asana, keeps you straight. Now you don't have any kneeling stool. You have to get it from Amazon.com, or you have a chair. Sit down in a chair. Sit down in a chair. How to sit down in a chair? Same way. You sit down in a chair. If you're in the front of the chair, your spine is straight. And that is the way you do it 24/7. You eat. You eat your food. You eat your food when you're in a dining table. Eat like this. If you're driving your car, be sure to drive your car with the spine straight. If you want to relax a little bit, go to the back of the chair, but still keep your spine straight. A fundamental principle of sitting in a chair. So let me show you one more time. Very, very important concept. It is not your age. I'm 70, I'm 75, I'm 80. It doesn't make any difference. I have seen other people. I teach little kids in the yoga. These people, kids cannot do even stand up in a balancing poses. They cannot do any of the asanas when you teach them. Why? Because their mind is in 24/7 with this. Either with this, a cell phone, or one of these video games. So take a look at me again. One more time. This is the beginning of your practice. Sideways. Sitting in the front of the chair, spine will be straight. This is 90 degree, 90 degree, 90 degree. Next question I get. I cannot touch the bottom of my feet. Put a little folded blanket. You will develop what is called neuroplasticity. That means slowly and slowly you will see your feet is sinking down. Even with this, your 90 degree angle. Slowly you take out the folded blanket, feet will touch the ground. Next, you want to be a little bit more comfortable. Go to the back of the chair. I'm going to the back of the chair. Keep my back straight. Concept. All the muscles in the back are keeping me upright because my skeleton will fall in the front. Start with this. Do it every 24/7. Initially, if you develop any discomfort, if you're sitting like this all the time, when you do this, you will have a little discomfort. When you discomfort, just go back slowly where you are. Try it again. Slowly and slowly, you will be able to do a perfect straight spine. And that's what you want to start. For us, we have been doing for some time. So what we'll be able to do, we'll be able to sit down in the ground. So when you sit in the ground, same phenomena is going to take place. What is the phenomena going to take place? You start with a simple, it is called a Sukhasana. cross-legged. You put one foot under leg, 1 foot under one knee, and the foot under one knee. Keep your spine straight. And most of the time, use your hand as a mudra. Because what the hand does, hand connects between your body and mind. How? If I want something, I put my hand will be there first before I can even say, give it to me. If I want to use something good, I will do this before I can say it is good. Hand always quiets down your mind. One beautiful mudra, we'll do a mudra tomorrow, we'll see. When I'm talking to somebody, when I'm really paying attention, my finger touches all of them. This is called a Hakini Mudra. I've seen so many times, I go to a conference, somebody is paying attention to the conference, their hand is like this without knowing. So this is called a Dhyana Mudra or a Jnana Mudra. Put your hand there, close your eyes. Now you feel a little discomfort. Let's say a little pain, back off. Find a place where you have a little bit of comfortable discomfort. Use a Dhyana Mudra, close your eyes, then you first do breathing out. You breathe out first, slowly take a deep breath in, and breathe out longer than breathing in. Keep doing it slowly with our eyes closed, spine straight, exhalation longer than inhalation, and slowly this thing is going to happen. Why? It happened to all of us. If you start pushing it, this is the mistake you do. Like, wait here, let it come down on its own. If you keep pushing it down, what will happen? It will come back higher. It's not going to go down. See, everything you're doing, Shankar is teaching you all the asanas, but these are the basis of how to learn the asana practice. We have age is not it's just a calendar number. So when you are comfortable like this, next thing you do is called balancing, activating both sides of your brain. Change your feet, sit down like this. What you will notice, one side is easier than the other side. What you're practicing it, the side which is a little bit more difficult for you, you will be practicing a little longer on that side. So components are, to start yoga, spine straight, eyes closed, hand mudras, exhalation longer than inhalation. Then what you can do to quiet down your mind, you bring little Brahmari Pranayam. What the Brahmari Pranayam does, it shuts down all of your five senses, creates a vibration. Our brain has a vibration, two vibration cancels, quiets down. It is called a harmonic resonance. In a harmonic resonance, mind quiets down. So let me show you one time. Put your index finger in the forehead. Use your three fingers to close your eyes. Use your thumb to close your ear. And always through your nose. Breathe out through your nose. Breathe in through your nose. Within a short time, you'll have a profound level of relaxation. It's a relaxation response. Then what you do, you progress. How do you progress? Now you take your heel all the way to the back, You take your one foot on the top and your knees will drop down. This is called Siddhasana. Sukhasana to the Siddhasana, and I have not done anything to get into this asana. What I have done, what I have practiced, I practice keep my spine straight, eyes closed, hand mudras, Brahmari Pranayam, or you can do Om Pranayam, you can do any chanting, you can do any mantras. Mantra. Man is your mind, tra is a vehicle. Mantra is a vehicle for your mind. It quiets down your mind. That's the name of the word, origin of the word, mantra. So now you are comfortable in this Siddhasana. Always change your feet. Go to the opposite side. You have done this one. Now, you have done this one. Sorry. Now you're doing Siddhasana in the opposite leg, activating both sides of your brain. What is it good for activating both sides of the brain? Always use a balance. I'm using my right hand to brush my teeth. Learn how to brush your teeth with your left hand. What will happen if you start brushing your left hand? First, the brush won't go anywhere. Brush will be like this. By the time you can bring the brush close to your teeth and start brushing, what will happen? Your right hand will be doing like this. Why? This is neuroplasticity. Our brain has a signal. I'm sitting here, not that I want it. My brain is allowing me to sit like this. So, from here, what I will do, I will slowly go to what is called your Ardha Padmasana. See, I'm showing you the step-by-step how to get into a asana, which is maybe a Padmasana, Lotus Pose. I could get into Lotus Pose very easily because I practice every day. But I'm showing you, so now here, I keep it, and I keep it here for some time. If I feel any pain, if I feel my breathing is not effortless. What is effortless breathing? I can talk, I can sing. See, in our practices, what we do, we can do any asana you can think of. I can do a Vajrasana, I can do a headstand, Sirsasana, I can do a shoulder stand, but still I'll be talking. Still I'll be breathing. And everywhere I present, and this is the way people introduces me. Oh, look at him. He's the one, he was singing when he was doing Vajrasana. Why? Because all these asanas came to me. I didn't ask for any asana. What did I ask for? To keep myself, Merudanda Achal, spine straight, and Manasthi, quiet down my mind. Any asanas you do, keep your spine straight. Any asanas you do, quiet down your mind. Any asanas you do, exhalation longer than inhalation. Somebody asked me when I'm doing, sometimes I feel I'm exhaling first, then I'm inhaling first. Nothing to do with inhalation and exhalation. It is effortless breathing. So how beautifully now, I can pick up other foot, bring it up. I can sit down in it. Lotus Pose, Padmasana. This is a profound relaxation response. A person who has not done this in step by step, where the person will say, oh my God, look at me. It looks hurting. No, I'm in total relaxed parasympathetic activation. I'm having saliva in my mouth. When you get saliva in your mouth, you know that your thing is activated. Now, look at me now. All of you are watching me, so I'm going to show it to you a little bit. I feel that I'm so comfortable I'm so fluid. I can turn around, move around. I feel a sense of lightness. And how do I test my lightness? I put my hands on both sides. Nothing doing. I don't do anything. Put my hands sides, push it down. My whole body goes high up. My whole body goes high up and stays high up. Tolasana. And I can stay here longer and longer time. Did I try to do Tolasana? No, I never tried to do Tolasana. So how can I do a Tolasana? Tolasana came to me. Tolasana said, hey, come on, come to me. Same way. So now you are here. If you do a very nice relaxing asana, it's a Yoga Mudra. In a Yoga Mudra, what you do, you hold your left hand to the back, keep your spine straight, look straight, breathe out first, take a deep breath in, and slowly get your head down. Head will come all the way down and touch it to the floor. What you will be doing in the regular practice is that when you come down to the asana, you stay there. How long? Between 5 to 10 nice, good breath. 5 to 10 breaths. Now, let me guide you through the asanas. What are the asanas you need to do for a daily practice, which will help you in causing called a preventive medicine. Yoga practice causes a primary prevention. Primary prevention means my father has a diabetes, my mother has a diabetes, my father has hypertension, we have all the diseases we have, but I'm going to get it. But I don't. Why? A practice of yoga causes a primary prevention. And how it does? Genetics doesn't cause a disease. Gene has to express. When the gene expresses, you get the disease. And gene gets expressed with a phenomena called epigenetics. And yoga practice is nothing but epigenetics. It also causes secondary prevention. Secondary prevention means I have an underlying disease, I have a diabetes, I have a hypertension, I have a coronary artery disease, I have an acute presentation, I had a usual and customary treatment, maybe surgery, chemotherapy, radiation. Then when I continue yoga practice, it prevents the progression of the disease. It prevents even the reversive disease. I had open heart surgery almost 21 years back. For last 15, 16 years, I don't have any, I don't take a single pill. I'm a disease-free, medication-free, I'm enjoying a good quality life. So I see somebody asked me, what are the therapies or what are the practices? Yeah, we'll go over with you slowly and slowly. But let me show you the next relaxation practice. Oh, another one asked me, what will be the nice book for a old yogi philosophy and modern therapy? This is the book. Just read my book. I'm not being publicizing my book. I'm telling you, this book has been written because whatever I've been teaching it to you, you want it to be in a book format. Whatever I'm teaching, everything is here. And it is all with your called yoga therapy, Ayurveda and Western medicine. Again, where do you find it? These days, only place to find is called Amazon.com. Next asana for daily practice. Very important, remember, you already do relaxing asanas. Vajrasana. Vajrasana is a must for everyday practice. So you do in stages. So first, you can sit down in a Vajrasana. You can do your heel, and you'll be able to sit down your heel and keep your spine straight. If you have any issue out of it, you can put a little bit of a folded blanket or folded mat you can put. What I really like, slowly and slowly, you can able to take it out. If you put a block, if you put something which you cannot reduce, you will never progress. From there, slowly you put your feet down and able to sit down on your Vajrasana. Vajrasana keeps your spine straight, supports your head. It is a wonderful, relaxing asana. Do it daily practice as a Vajrasana. For how long? If you can do it between 5 to 10 breaths, is very good. But generally, Vajrasana is done after our meal. So when you do after your meal, we generally sit down. I mean, time is a time. See, when your mind quiets down, you don't have any sense of any time. Time is a sense when your mind is active. So when you close your eyes in a Vajrasana or when you're meditating, you have no idea how long you have been doing it. So from the Vajrasana, you have started, it stayed in stages. You have done in stages. You have done your Lotus Pose, Padmasana, or sitting on a Vajrasana. From Vajrasana, you do Mundukasana. Why? Every disease we have after our vital organ, every disease is here in the abdominal contents. So a powerful yogic practice is called Udar Karshan. Udar is your stomach, Karshan is the massage. Massaging all the internal organs. It will prepare your abdominal wall. You relax your abdominal wall, prepare your abdominal wall, which helps you. Doing a nice Kapalbhati Pranayama, will be doing able to do your Agnisar Kriya. You can do it step by step. Shankar has shown it to you. You can use a hand, you can do a hand mudra. This is called your Adhi Mudra. Adhi Mudra keeps you very relaxed. You know, you do relaxing asanas. So, say, if you look at a baby, this is called Balo Mushti Mudra, baby fist. You put your hand here. If you see a hand is relaxed, see all the fingers are separated. When hand is not relaxed, fingers are tight. When the hand is tight, finger doesn't go like this. A relaxed finger goes like this. So throughout the whole day, you close your fist like this. All the pain in the hand will go away. Pain in the hand is due to tightness of all the ligaments and joints. Thumb inside and close. Baby fist. Balo Mushti Mudra. Many a time we do the breathing. Breathe out first. Take a deep breath in and breathe out. Breathe in, breathe out. Wrist gets relaxed with extension. Breathe in, breathe out. Breathe in, breathe out. You always practice relaxation. Shoulder. Put your shoulder there and breathe out first, breathe in. Slowly rotate your shoulder. I'm going to just show you how to do it, and you'll be doing it more and more at home. And then do the opposite. Breathe in to the opposite side. Breathe out. Do it with the eyes closed. When you do the eyes closed and follow your breathing, you'll be amazed how easily you get into this relaxation response. A powerful asana, relaxing the whole upper body, which you do every day, called Paschim Namaskar. So let me show you. You'll be seeing what a Paschim Namaskar is. So show you my back like this, so I'm able to see how beautiful Paschim Namaskar is. That's good. Put your hand in the back. Wherever it is, if it is here, stay here. Keep doing your breathing. Hands will come up here. When hand comes up here, close your eyes, do your breathing, and slowly, hand will be in a prayer pose, Namaskar Mudra. When it stays in the Namaskar Mudra, and keep it here, hands will keep on going high up. Go all the way high up. And if you keep it here, do your breathing, it is slowly it will keep going up more and more. Paschim Namaskar is a powerful, relaxing asana. So what you do a Paschim Namaskar, and with the Paschim Namaskar, and you stay in the Paschim Namaskar. And I teach the Paschim Namaskar all the time to all the computer people. And then when you keep it, the hand in a Paschim Namaskar, and keep doing it for a little longer and longer period of time, what happens? More and more relaxation sets in. So your relaxation will set in. 3 stages of asanas: arambha, beginning; sthiti, fasciculation is gone; and visarjan, profound relaxation. So my hand is there. My hand is there, and I am in a total state of relaxation. Next relaxation practice you do is called your Brahma Mudra. Brahma Mudra is your 4 steps in the neck, and you do with your Brahmari Pranayam. See how beautiful practice this is. Slowly you drop your head to the back, is a breathe in. And breathing out, you do a sound of a bumblebee. So I extended my exhalation. Very important, I extended my exhalation. And what happened? What I was looking for pain. There was no pain, and I have an effortless breathing. Second, in the center, you go to both sides. Breathe out first, take a deep breath in. Third, look all the way to the back without turning your shoulder. Once to the left, next to the right. Again, breathe out first. Take a deep breath in. Fine, rotate your head, left to the back to the right, and right to the back to the left. Drop your head down, breathe out first, take a deep breath in. See, my hand was in the back all the time, but I had a profound level of relaxation. So what happened with this, that now my body and mind is ready for any kind of asana practice you want to do. See, all the warm-up you did with Shankar, all the asanas you did with the Shankar, will be as simple for you without any effort in it. So prepare in stages Padmasana, prepare your stages, your Vajrasana, prepare your Paschim Namaskar, prepare your Brahma Mudra, relax your lower part of the body. I really don't have to do all these asanas because Shankar has already done it for you. Shankar has shown you. Face down, you do Makarasana, the Bhujangasana, you do Shalabhasana, the locust. Bhujangasana is a cobra. You do Dhanurasana, bow pose. Laying down, you will do the asanas. You will see how simple all the asanas becomes. First, you do with your toes. Put your hands down. It's called Dandasana. You separate your toes. More you separate your toes, more relaxed your whole body and mind will be. So breathe in, breathe out. Just the toes. Breathe in, breathe out. Do with your eyes closed. Breathe in, breathe out. Ankle. Remember the relaxation of the ankle is the Mool Mantra, main practice, because knee joint and hip joint is transmitter of your body weight. So breathe in, breathe out. Breathe in, breathe out. Slowly rotate. With your breathing, you rotate your ankle. Breathe in, rotate your ankle. So when you relax, when you put your feet down, you will see all of your toes are separated. When the toes are all crumbled, you get into a very tight situation. When you relax, you do very nice Paschimottanasana, seated forward bend. Your hand is here, hand slowly, whatever. Remember, you are where you are. If you're here, stay here. Stay here, close your eyes, do your breathing out longer than breathing in, 5 to 10 breaths, slowly and slowly this thing will happen. When this thing will be able to hold it, keep your spine straight, close your eyes, and slowly try to drop your head down. When your head is coming down slowly, you come to the posture, you'll be able to clasp your hand, keep your knees straight, and head will come all the way down. When you practice relaxation response, your body is almost like, say, rubber band. We practice with this. This is our health parameters. We're measuring our heart rate, our EKG. This is the EKG. I can use a EKG here and I can see what is going on in my heart. Relax your knees and hips. Very easy relaxation. Put your one leg straight high up. Take the other foot in the top. Now see what I'm doing. I have my fingers. I put the fingers slowly in between my toes. What a beautiful practice. I put in between my toes. All the toes gets relaxed. More feet get relaxed. See, before it was very tight. It doesn't go through. Now it goes in and out. In and out. Same like your hands get relaxed. Hand gets tight, it will be like this. So when the feet get relaxed, you put your hand here. Slowly take your knee joint high up. The baby. Hug your baby. Breathe out first. Take a deep breath in. And let's slowly drop your knee down. It goes all the way down to the ground. I don't push it. If you push it, if it is here, let it be here. Close your eyes. Breathe out longer than breathing in. This is going to happen. Knee gets relaxed, hip gets relaxed. Knee is the site of fear. Hip is the site of emotion. Fear of unknown is your stress. So able to relax your knee joint is a stress reduction asanas. Breathe in, breathe out. Breathe in, breathe out. Always balance it on the other side. Now we take that other foot high up. Same phenomena. Fingers in between your toes. Hold your knee, bring it up. Breathe in and slowly it will go all the way down. Breathe in. Breathe out. In my class, I practice all the time with a couple of people from my class so they know. Do it. Hip joint relaxation. Absolutely important asana. Fit together. Slowly bring it close to you. Hips are up here, it's fine. See, you will notice one thing, what is going to happen. Slowly and slowly bring it down. Put your hand here. Close your eyes and keep relaxation. Spine straight, eyes closed, breathing out longer than breathing in, and we'll see both the knees are coming down to the ground. Perfect example of 3 stages of asana. Beginning, arambha, stillness, sthiti, profound relaxation, visarjan. Arambha, sthiti, visarjan. So before, I was not touching the ground. But in a short time, see, I'm touching the ground on both sides. It's a wonderful practice. I'm going to show you a couple of asanas which are really powerful, relaxing, therapeutic asanas to prepare your body and mind so you can do all the practices what Shankar is sharing with you. He'll be sharing more even tomorrow morning. I'm supposed to be there tomorrow, but I have a little bit of assignment tomorrow morning, so he'll be doing it. From here, see how simple it is? Take your one knee, take other knee, put it down, one in the top. Vajrasana. In fact, this is the way, Vaisa means your buffalo, cow. That's the way they sit down. When they sit down, they cross their in the front. In fact, this is so relaxing asana that if you keep on doing it, if you're sitting in a chair, you'll be putting your feet will go up like this. It happens so many times with me. I'm sitting in a conference, I'm sitting, suddenly I see my feet is like this. Keep it here, breathe in and out. And this is the preliminary for called also Gomukhasana, cow face. It's a metaphor, it looks like it is a cow face. But it goes with your relaxation. So here, if you look at this asana, relaxing your feet, relaxing your ankle, relaxing your knees, relaxing your hip, relaxing your back, upper part, whole body get relaxed. Now incorporate in your upper part of the body. How to do upper part of the body? It's a Gomukhasana, cow face. Profound relaxation response. So, let me show it to the back so you will see better. Yes, you can see me very well. My right knee is the top of my left knee. My right hand goes high up. Left hand comes here. You can hold the elbow. You can put down the left hand in the middle. Right hand will go down, touch it, hook it. Essentially, I handshake each other. I'm totally effortless. I'm totally comfortable. Absolutely have no effort in doing this. This is a yoga practice. Now you'll see the difference. Here is if now I'm doing the opposite. Now I'm putting my left knee on the top of my right knee. My left hand goes high up. My right hand again, I stabilize my right hand. I put my right hand in the middle. Then when I drop my left hand, it touches, it hooking, and literally I'm handshaking each other. What is happening here, both sides is equal, both sides is comfortable. I'm very comfortable in this asana. On this asana, my whole upper part of the body is relaxed. My hand is relaxed, my wrist is relaxed, my elbow is relaxed, my shoulder is relaxed, my neck is relaxed. So in a Gomukhasana or cow face, my whole upper part and lower part of the body is relaxed. So when I'm able to do a Gomukhasana, then I have no problem doing any kind of asana. Like when I was talking, somebody asked me, what do you do for Pyriformis syndrome? And Shankar told me, they showed it to you. See how simple it is. You are here, one knee is in the top. Because I'm relaxed, I'm not going to try a Ardha Matsyendrasana. Ardha Matsyendrasana will come to me. How it is coming to me? Yes, my right foot goes high up here. Can I sit down here? Take my time. I breathe effortlessly. Slowly, I push my right knee towards a little bit on the left side. Bring my left hand up here. It comes outside my left knee. Right hand goes to the back. Left hand is up here. Slowly drops down into my knee. Come to my ankle. Come to my foot. Take a deep breath in. And slowly turn my body away from me. I'm breathing. I'm totally effortless. Pyriformis syndrome is one of the disaster when you have it. I'm showing you the step by step. After asana, you have done all the pranayamas. Shankar is going to do. I'm going to show you the pranayamas, the 7 pranayamas, which Swami Ramdev talks about all the time. But even for the pranayama, you need to practice your physical body. What asana you do for pranayama practice? You do one asana for pranayama practice. That asana name is given in our Yoga Sutra. That asana is called Sthiram Sukham Asana. Stillness, happiness in a pose. I'm sitting here. My body is still. I feel sukhi. I'm relaxed. That's the time I can do pranayama. In a daily, we do 1 hour practice, 25 minutes asanas, 25 minutes pranayamas, 10 minutes of meditation. We do not do meditation. Meditation comes to us. Remember, I'm trying to do meditation. If my physical body is not ready, my knee joint will start shaking, or I have a little bit of looks like something crawling in my body. My mind is always in a state of disruption. Prepare your physical body. Prepare your breath. Mind will quiet down. Breath is a connector between your body and mind. I give this metaphor all the time. If you're flying a kite, the roller is the body, the kite is the mind, and the thread is your breath. Breath is connecting. A profound relaxation experience which you will get, and this is a powerful sign of a health. If you're talking about health, look at what is a powerful sign of health. You'll be able to sit down in a called your Malasa, squatting pose. And when you're able to sit down in the Malasan, in a Malasan, you put your hands together. Your hands together and bring your wrist, relax. Keep your one elbow inside, other elbow inside, and slowly bring your hand close to you. Keep your spine straight. Keep your eyes closed. You're breathing out longer than breathing in. And believe me, there is no disease will come to you. From here, you learn how to get up without a support. From here, you'll get up without a support. It's very, very important practice from your Malasan, you get up into your standing poses. When you stand up in standing poses, you have to be sure your body is exactly straight. This is called your Dandasana. Your body is like a stick. In a Dandasana, what you can do, you can always practice against a wall. Like if you're against a wall, I'm against a, here, you keep your body here and keep your body against a wall, and your ankle, your hips, your shoulder and your head should be in the same line. Then put your hands way high up. This will be your straight high up. Close your eyes. You breathe out longer than breathing in. Stay here between 5 to 10 breaths. When you bring up here, I'm showing you the practices which you will need to prepare your body and mind so you'll be able to do a name asana. You name an asana, you'll be able to do it. Balancing. I'm very comfortable standing with my feet apart. I practice put my feet together. I put my feet together. Then I see if I can do my balancing poses. Balancing poses is if I need to keep my balance, my hand helps me in my balance. My vision helps me in my balance. My hearing helps me in my balance. So what I do, so if you fall down, what will happen? You always fall in an outstretched hand. When you sit down in an outstretched hand, you develop fracture, which is called a Colles fracture, very famous fracture in outstretched hand. So take your hand up, take your hand to the back, do a prayer pose to the back. Paschim Namaskar, standing up. Now I'm right-handed, right-footed. See if I can stand on my left foot. I'm trying to stand on my left foot. 10 seconds, feels like almost 10 years. 20 seconds, 40 seconds. Finally, you have to do an impossible task. See if you can stand with your eyes closed. When you're able to stand with your eyes closed, you develop a profound level of balancing poses. No disease will come to you. No disease will come to you. Practice in the opposite side. By the time you'll be able to do it, close your eyes, see if you can do it. You know, I do it every single day, but still I also get a little wobbly. If you can do this, your recursion, your eagle pose, these all become a very simple asana. Next one is a very important yogic concept is called keeping a head below your heart. What the head below your heart does, it creates a sense of your called adaptation. What is adaptation is you try to separate your feet first. This is called Prasharito Uttanasana. You're separating your feet, slowly and slowly you separate. Then you try to drop your head down. If you put your head below your heart, pressure inside the head goes high up. You call it increased intracranial pressure. Pressure inside the eyes goes high up. Pressure inside the neck arteries goes high up. But if you keep your head down for a longer and longer time, the body's homeostasis comes in. When the body's homeostasis comes in, the pressure in the head comes down, pressure in the eyes comes down, pressure in the neck comes down, and you feel a profound level of relaxation. Your breathing becomes effortless, and you will be able to do a Kapalbhati Pranayama. Remember, when you are relaxed, you do a Kapalbhati Pranayama. Kapalbhati relaxation of the abdominal muscles. So here I am. Take a look how beautiful it is. Prasharita Uttanasana with a Kapalbhati Pranayama. Slowly I put my hand down. I put my hand in the front. I can spread my leg almost to the width of the mat. Slowly my head goes down to the ground. My hand touches both the leg. And I do a Kapalbhati Pranayama here. These are all preparatory asanas for all of your so-called difficult asana. There is nothing called difficult asana. All the asanas will come to you. All the asanas will come to you. Now, after this, you will do a set of asanas. Set of asanas are primarily sitting down, Vajrasana, Mandukasana, and Shashanka Asana. Gomukhasana, then you lay down your face down, you do Makarasana, then you do your Bhujangasana, Cobra Pose, then you do your Locust, Shalabhasana, then you do Dhanurasana. And with the face up, you simply what you do with the face up is that you keep doing it, all the laying down poses, which are very relaxing to massage your abdominal muscles. And how to do it? See, you are doing it very simple. You are laying down here now. When you lay down, be sure your chin is below your head. When the chin is above your head, you get a little bit of it. You are very relaxing. You know, you really don't need a savasana. When you are in relaxing asanas, every asana is a savasana. So what you do a Padottanasana. Raise your feet high up. Feet high up, slowly get your body high up. You get into a Nokasana. Both pose. When you get into a Nokasana, you stay here. You can feel the unsteadiness. From here, you do a Pavanmuktasana. Bring your high up, Pavanmuktasana, which Shankar has already shown it to you. Markadasana, very simple hand. Put your both the knees down, look another side. But the most important thing is able to stay in the pose. Close your eyes as if you were sleeping on this pose. You can do Setu Bandhasana, you can do a Sarvangasana, Halasana, all will come to you. So if you want to see what the relaxation does to you, let me just show you one asana, which you understand. So I'm going to do a Sarvangasana. My whole body goes high up. In a Sarvangasana, I'm going to do a Padmasana. It's a Padma Asana in a Sarvanga Asana. How is it possible? Because of the relaxation. You can get your feet all the way up there as a Halasana. So you're preparing your body with all the relaxation for a set of pranayama. What you do, we really do the relaxation, we do a set of asanas, the one Shankar was guiding it to you. Prepare your body, Surya Namaskar, prepare your body with your yogic jogging, do everything, prepare your body asana, then is some must practices of pranayama. You do Bastrika Pranayama, Kapalbhati Pranayama, Anulom Vilom Pranayama. You do the bandhas, Mula Bandh, Udyani Bandh, Jalandhar Bandh. You do Ujjayi Pranayam, Brahmari Pranayam, Sitali Pranayam, Om Pranayam, or Pranaho Pranayam. Doesn't take much time when you keep on doing it. So, like, say, if you're preparing yourself, prepare your body and mind, say, you want to do called difficult asana. What is a difficult asana? I don't know what a difficult asana is. Say, do you want to do it?
Maybe Mayurasana.
Mayurasana. Who is this?
This is Amol.
Amol?
Yeah.
Thank you. You could read my mind, huh? How about a Bakasana?
Also Sisasana.
How about a Mayuri Asana? You know what Mayuri Asana is? Okay, let me show it to you. I don't know if I'm able to do it or not, huh? Oh gosh, my body is very aching, painful. No, I'm just kidding, huh? Sit down, how beautiful it is. You can see me? Put your hands here. Put your hands here, bend your elbows, so support your body. When you support your body, you push your body in the front, your body in the front, and the whole body. So, push it. It is touching. Looking at me now, put your elbows, put your body weight on the elbows, and put your body in the front, push your body in the front, and your whole body is going to go away. What you learn in that, generally, for the practice sake, we do all the practice in the morning. And I can feel the difference. I really don't do practice in the evening. This is our East Coast, 7:15 is our East Coast time, but many people need to do it. So that's to do. Amal, this is called Mayuri Asana. You know, in the animal world, women are more powerful than the men. Even this world too, huh?
That's right.
You do Padmasana first, and you do a Mayurasana and a Padmasana. You do a Padmasana. From a Padmasana, you do Mayurasana. Morning, it is so easy, so effortless, and absolutely no problem. This is called Mayuri Asana. Same way, if you want to say, king of all the asanas, huh? As I want to practice Shirshasana. You don't practice Sirsasana. Sirsasana will come to you. How? Look at the steps. What is the most relaxing asana we talk about? Is your Vajrasana. So sit down in a Vajrasana. In a Vajrasana here, you become very relaxed. This is your stance. Put your stance here. Clasp your hand. Put your head on the ground. And you feel miserable. You cannot talk, you cannot breathe. But you stay here a little longer and longer and longer. Now you can talk, your breathing normalizes. You get up and just keep walking. When you keep walking, your body is going to go high. When your body is going to high up, say I'm talking, I'm breathing, I'm totally effortless. But when it comes down, come to a point, I come back. So I'm not pushing myself. And also, I'm not getting any help from anybody. My body is going to go high up itself. And as I said, I do it in the morning. I prefer to do it in the morning, and I'll just show you the technique how to do it. Keep your head down and slowly keep just like walking. Your whole body will go high up.
Dr. Sarkar, can you show the Asana tomorrow morning, please?
Same thing. I will show it to you. It will come to you.
The reason.
Put your head down and close your eyes. Relax your body.
Dr. Sarkar, the only reason I was asking because I could not see the position of hand and head because of your laptop position.
This is your hand. This is your clasp your hand. Put your head down and just, can you see my head down?
No, doctor. We cannot see it. That's what I was asking because of the laptop position.
How about now? Can you see now?
Yeah, we can see it.
Yeah. Now it's better. Yeah.
Yeah. No, I think it is your laptop. We are able to see him fine.
Yeah.
Okay. Yeah. I can see it now. Yeah, I can see it now. Yeah.
And just keep walking. Don't push yourself. Keep walking, and you will see one day it'll go higher.
Is the emphasis on the hands more or the head more, or hand is more support?
People talks about putting your hand pressure, head pressure, all pressure. Emphasis on relaxation.
Relaxation.
Headstand is a purely relaxation practice. What you will need here, take a look at it here now. This is very important. In a headstand, you always fall down in the front. But you need to fall down. If you don't fall down a few times, you'll never learn it.
Yeah.
And how do you fall down? Become like a baby. So how do you fall down? Very simple. Put your head down. Head down, go high up.
That's it. Forward.
See, nothing to it. Because what happens, your body is relaxed. I didn't do anything, even flip over. You know, I've crossed certain number of years in my life, but I'm like a baby. You just see how I fall over? Because I did not make any effort to fall.
Right.
And that is the basis of your practice. And all you guys do is you're trying to, I want to do it. If one is better, one is good, 10 is better, huh? I want to do like Shankar, the way Shankar is doing his. Surya Namaskar. Yeah, I can do it, all of them. But I do it in stages. Okay, when you relax now, you do a pranayama. We have been doing all the pranayamas, but let me show you the guidance of the pranayamas. What the guidance of the pranayamas are, the first pranayama is that you are able to learn how to breathe out longer than breathing in. Use your hands like a Adhi Mudra. Keep your spine straight. First, remember in all your practice, to breathe out first. Take a deep breath in and breathe out longer than breathing in. Continuously doing it. If you keep on doing it slowly and slowly, your time will increase because the muscles are trainable. Muscles are trainable. You can do 2 seconds in, 4 seconds out. It's simple. Breathe out first, 2 seconds in, 4 seconds out. Slowly, we do it for a long time. I can do it very easily. Let me show it to you. I can do it 6 seconds in, 12 seconds out. very easy for me. And that's the way you even breathe during a sleeping. Exhalation longer than inhalation. The first gateway of pranayama, I'm not going to do the whole setup. I'm just going to show it to you, the technique, because it's the evening time. Even in the evening time you do, but we prefer in the morning, with all the practices. So you're sitting down comfortably, hand you can put down in an Adhi Mudra, and Bhastrika is active inhalation, active exhalation. But you do it as long as your breath will allow and your breath is effortless. Effortless means you can talk, you can sing, you can even do as if you're doing a breathing. We do a Jalneti every morning. You will see tomorrow morning, we'll see you all the Kriyas, Jalnetis, and you get some range. But slowly and slowly, what you do, you slowly and slowly you increase the speed of Bhastrika Pranayam, but effortlessly. Effortlessly means you can talk, you can sing. So let me show you a little sample when I do it and how long you'll be able to do it. A little rapid Bhastrika Pranayama will look like this. I did 200 of them. I'm talking, I'm breathing, I'm effortless. So people ask me, how long I'm going to do it? How long? No, you do it as long as your body will allow. Initially, we do only 5 seconds, 10 seconds, 30 seconds. Say, I'm having saliva in my mouth. My mouth is wet. I've been talking to you for the last almost hour and a half or 2 hours. I did not drink any water. My mouth is wet. Parasympathetic activation. It causes called hyperventilation syndrome. You get an altered level of consciousness, get a circumpolar numbness, a little bit of spasm in your hands. It is entirely normal. But now your whole lung is empty. You can breathe in and out, maybe about 4 times than what you can normally breathe in and breathe out. You do 3 stages breathing. It's called your lower part of the lung, middle part of the lung, upper part of the lung. Lower part, your abdomen fills up a little bit. Middle part, chest fills up a little bit. Upper part, your clavicle rises. Bhastrika is followed by Kapalbhati. In a Kapalbhati, Kapal is the forehead, Bhati is the shine. Bhastrika is very good for your respiratory diseases like your asthma, COPD, pulmonary fibrosis, and it's the gateway of your pranayama. Prepare your lung. Remember, you had all the dead, all the toxic gases are sitting, all came out. We do all hand raising, all these ways, we do many ways. But it's an active inhalation, active exhalation. You can do a hand raise, you can do hands on the side. In a Kapalbhati, you have awareness is in the belly button. You push your whole abdomen in, it hits the diaphragm, hits the lung, air comes out. So now you keep your spine straight. You have a mudras. This is called your Dhyana Mudra or Jnana Mudra. Bend your index finger down. It's called a Vayu Mudra. Controls your vata. They call it Shunya Mudra. Controls your hearing. They call it Prithvi Mudra. So grounding for the obesity and diabetes. This is called Varun Mudra. Touching your little finger. Shakti Mudra. Little finger, ring finger and thumb. Apna Mudra. Middle finger, ring finger and thumb. Apna Vayu Mudra. We'll do the mudras tomorrow. We'll go one after another, mudra practices. But we do these mudras because remember, mudra connects your body and mind. So do a Kapalbhati Pranayama in a mudra. So do each mudra. If you can do a Kapalbhati Pranayama first, do it, or body will allow. But when you keep able to do it, we do it for about maybe 50 Kapalbhati Pranayama in each mudra. But we'll do just give a sample how to do it. Like I'm doing it, close my eyes. Technique is, many a time people say, I cannot do. Put your hand in the belly button, hand under the nose. So when you push it in, air will come out. And the person, I cannot do it. What should I do? Why don't you cough? Give me a cough. Okay, you can cough now. Try to cough with your mouth closed. Keep your mouth closed and try to cough. It becomes Kapalbhati Pranayama. So close your eyes, do your mudras, and just switch over your mudras and do Kapalbhati Pranayama. And I can tell you the benefit. You can keep doing it with me if you want to. Keep doing it, I'll tell you the benefit. See that? I'm not breathing. I'm just breathing out. It's an active exhalation. I'm breathing in between without knowing. Change your mudras, Vayu Mudra. I don't know, I really don't learn how to breathe in. The day I was born, I learned how to breathe in. Switch back to correct Shunya Mudra. Massages of the internal organs. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your small intestine, massages your colon. For the women, it massages your uterus, tubes and ovaries. For men, it massages your prostate, your bladder. Prithvi Mudra with Kapalbhati Pranayama is ideal for your diabetes and your belly fat, abdominal obesity. Varun Mudra. We'll do all the mudras tomorrow. You'll see the mudras. Kapalbhati Pranayama is followed by, because it's relaxed, you do the Uddiyani Pranayama. You breathe out first, take a deep breath in, completely breathe out, suck your stomach in and hold. Breathe out first, a deep breath in, completely breathe out. It is also called Bajra Pranayam because you're breath holding in exhalation, breathing out and holding your breath. When your abdominal wall is very relaxed, you can do a Agni Kriya. You can massage all the internal organs. Same practice, you suck your stomach in, then move your abdominal wall. Breathe out first. Take a deep breath in. Wonderful practice. Very good for your diabetes, very good for your truncal obesity, very good massaging all the internal organs. You do Jalandhar Bandh. Keep your neck straight. Slowly bring your chin down, touch your chin to the chest and stay here. It's called Jalandhar Bandh. Chin lock. Chin lock stimulates called carotid sinuses. There are two organs here, carotid sinuses. Carotid sinus massage causes a profound relaxation response and mediates through your Vajrasana. You do the breath holding in exhalation. Now you do the breath holding in inhalation. You do the breath holding in inhalation and you do the Jalandhar Bandha. It's called the Murcha Pranayama. So to do it, breathe out first. Take a deep breath in. Hold your breath and slowly drop your chin down, touch your chin to the chest. Stay here and keep counting. When you count, it is called 1 and a 2 and a 3. It is so relaxing, it says, Murcha means fainting. You are going to faint. It follows with the Anulom Vilom Pranayam. Anulom Vilom Pranayam, also your hand, left hand, with the Adhi Mudra, touch your index finger and thumb. Right hand, close your right nostril. You don't have to close all the way down, just put it just below your right nostril. It's good enough. Then you breathe out through left nostril first. Breathe in through your left nostril. Drop your finger down, close your left nostril with the ring finger and little finger and breathe out through your right nostril. Try to do longer exhalation than inhalation. You keep on doing it, let me tell you the benefit. Left nostril is controlled by your right brain. Right brain is intuitive, right brain is cooling, right brain is female. Left nostril breathing is called Chandranaya, moon energy, is parasympathetic. Right nostril is controlled by the left brain. Left brain is analytical, left brain is heating, left brain is made. Right nostril breathing is called Suranadi, sun energy, sympathetic. Many a time you can bring your both index finger and middle finger in the third eye, close your eyes, bring your awareness in the third eye, and do alternate nostril breathing. Within a short time, you will enter into a profound level of relaxation. Wonderful practice. Generally, when you keep on doing it for a long time, you can do it between 5 to 10 minutes in alternate nostril breathing or Anulom Vilom Pranayama. Initially, you do as long as you have an effortless breathing. It follows with your Ujjayi Pranayam. In the Ujjayi Pranayam, what you do, you close your larynx and try to breathe in. It's called resistant inhalation. In larynx is supplied with a nerve called your vagus nerve. Vagus nerve stimulates, the signal goes into your brainstem, and the signal comes out through called cranial nerves. It comes first to the 12th nerve called hypoglossal nerve. It supplies the tongue. It pushes the tongue in front. When it pushes the tongue in front, it creates a phenomena which corrects your sleep apnea. Sleep apnea is a Ujjayi Pranayam is a therapy. Also, it supplies the muscle to your soft palate. There are two muscles called your palatopharyngeus, palatoglossus, and it causes your tightening of the muscle, the snoring goes away. So the way to practice is again do your Adhi Mudra. When you develop little cough, that is a normal, because the cough comes from the larynx where you are going to constrict. It also affects your relaxed. This is a very nice way you can do a Ujjayi Pranayam and do a Jalandhar Bandha and do a left nostril breathing. All are very calming and cooling. The way you do it, breathe out first. Take a deep breath in. Completely breathe out. It is so relaxing, so calming, and it really acts as we call it a preventive medicine. It prevents. No disease will come to you. Endogenous diseases all gets controlled. So wonderful practice, Ujjayi Pranayam. Ujjayi Pranayam is followed by many a time. It's called a Shankar Pranayam. Shankar Pranayam like a blowing your conch shell. Remember, you always breathe through our nostril. We are talking about today that if you breathe through your mouth, you don't know where the air has gone. You've gone to the larynx, the lung, or to the stomach. But if you breathe through your nostril, air goes through your nose. Nose is a filter. It filters all the air. Nose is a personal air conditioner. Air goes through your nose. If outside air is warm, it will cool it down. If outside air is cool, it will warm it up. And then the air goes to the both sides of the nostril with a turbinate. And the air goes directly into your larynx and the lung. So all the air through the nostril goes into your lung. It doesn't go through your foot channel. But if you have to breathe through your mouth, you can always breathe out. Breathe in through your nostril, breathe out through your mouth. But we use the mouth breathing for your Shankar Pranayam to improve your lung function. Also do Shitali Pranayam, Siddhkari Pranayam. That cools down your body. So Shankar Pranayam is do your Adhi Mudra, put one in the thumb, breathe out first, take a breathe in through your nostril and breathe out as if you're blowing a conch shell. So you practice blowing a conch shell, it will be your pranayama practice. Brahmari Pranayam, I already shown it to you, how to do Brahmari Pranayam. Generally, we do it, when you do it, I do it between 3 to 5 to 7. And based on the time, I do this is all the time I do a Udyani Bandh with a Jalandhar Bandh, or so Udyani Bandh with a Agnisar Kriya. Then we do it about 5 times, 7 times. And finally, what you do, you do a Om Pranayam, or another very nice pranayam is called a Pranabha Pranayam. Pranabha Pranayam, what you can do a Pranabha Pranayam with a mudra. This is called a Dhano Mudra or Gyano Mudra. This is when you put your hands high up. When you put your hands down, this is called your Chin Mudra. Close your hands, this is called your Chinmay Mudra. Put your thumb inside and close, this is called your Adhi Mudra. Chin Mudra opens lower part of the lung. Chinmay Mudra opens the middle part of the lung. Adhi Mudra opens your upper part of the lung. Om has a 3 component, A, U, Ma. A, U, M. A comes from the lower part of the lung. U comes from the middle part of the lung. Ma comes from the upper part of the lung. We'll do 3 mudras, 3 sound, and then we'll finish with a called meditative pranayama. Meditative pranayama is called your breath-centered pranayama, and alternate nostril breathing without closing your nostril. Sounds impossible, but you'll see how beautiful practice it is. Touch your thing, index finger and thumb, put your hands down. Keep spine straight, eyes closed, breathe out first. You breathe in through your nostril and breathe out with the sound of A through your mouth. Change your mudra to Chinmay Mudra. U. Breathe out first. Take a deep breath in. Adhi Mudra, thumb inside and close, and it's Ma. Breathe out first. Take a deep breath in. We'll finish our meditative practice, a meditation called meditative alternate nostril breathing in your silence and with your eyes closed. So sit down comfortably. If you're doing in a Siddhasana or a Sukhasana, sit in a chair, very comfortable way. Touch your index finger and thumb, put it over your knees, close your eyes, and first visualize your breath. Remember, when you are body and mind together, you can visualize your whole body with eyes closed. I showed it to you. My eyes are closed. I can easily touch my nose, easily touch my left index finger, touching my left knee, touching my top of my head, touching the earlobe. My eyes are closed. I can clearly see my body. That is the way you do. That is your meditative time. Meditation, I told you, I explained to you this afternoon. that meditation is 24/7. Chitta vritti nirodha. So visualize your breath. Breathe out first. Visualize your breath is coming through your nostril. Air is getting filtered, air is getting air conditioned, air is on the side of the nostril, it is going behind your throat, upper part of your trachea, slowly going down into the lower part of the lung, almost to the level of your belly button. In the belly button, it all automatically breath stops for a short time. It is called Kebul Kumhak. Visualize breath is coming out from lower part of the lung, middle part of the lung, upper part of the lung, and breath is coming out through your nostril. When breath comes out through your nostril, outside your nose, it's picking up your prana. Remember, breath is the carrier of the prana. Prana is the life force which does your breathing. So breath is picking up the prana, and in yogic practice, it is not the lung which does breathing. Your whole body does breathing. Every organ breathes. Your skin does breathing. So you visualize prana is coming inside through your breath. Visualize that prana is going to the organ of your healing. If you have a knee joint problem, visualize prana is going through your knee joint. It is called pranic healing. It's a wonderful yoga practice. I have a heart problem, I visualize prana is coming to my heart and we're healing of my heart. If you have a diabetes, you visualize prana is coming to your pancreas, doing the healing. Also do the pranic healing. Slowly and slowly, you bring your awareness in the nostril again. Now you do what is initially feel like impossible, but it will be very possible for you. You will be doing it in a silence. I'm talking, I'm telling you. Visualize your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly visualize I'm breathing through my one nostril. I'm breathing out through the other nostril. Let's keep in silence, quiet down your mind, and a silence to get alternate nostril breathing for a few minutes, and I'll give you a signal when it is over. Slowly bring your hand in front of you, touch your little finger and thumb, separate your ring finger, middle finger, and index finger. This is called a Padma Mudra. Padma Mudra connects your body, mind, and spirit, which is truly a practice of yoga. It is in front of your heart chakra. Put your hands together, bow your head down, and say Namaste. Namaste means I honor the divinity within you. You are divine, and I honor the divinity. Finish your practice with the thumbing and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, you can remove your glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand, then you massage your forehead, massage your eyes, massage your face, and always massage back of your ear, in front of your ear, in the tragus, inside your external ear canal. There is a called auricular branch of the vagus nerve. It is a very calming, cooling, and relaxing. Massage your carotid sinuses here, very relaxing. Massage your face. Open your eyes slowly. It's a wonderful practice. This is your practice which takes you from your gross body to your subtle body to your unmanifest. And with the unmanifest, you have a wonderful practice. Let's finish. Let me see if you have any questions. I'll be glad to answer those questions. And if you can unmute, and if you want to ask any questions, it'll be fine. And Amal, you are still here. You can read those questions for me, if you don't mind. I have a hard time reading it from a distance.
Can you show me one more time that Chin Mudra? Then, but what was the second one? Chin Mudra.
This is when you do it's like a Dhanu Mudra. Touch your index finger and thumb. But if you put it over your hands high up, this is a Dhanu Mudra. Put your hands down. This is the Chin Mudra. And you close your all the fingers. This is the Chinmay Mudra. The Chin Mudra opens up lower part of the lung. Chinmay Mudra opens your middle part of your lung. And this is your Adhi Mudra. Take your hands, thumb inside and close. Adhi Mudra, it opens upper part of your lung. Chin Mudra, Chinmay Mudra, Adhi Mudra. And you do this with the A, U, Ma. It's a Pranabhu Pranayam. Very nice. What else?
Thank you.
Let me see. Amal, do you have any questions here or no?
Looks like it was so nice. Nobody asked any question.
Beautiful. That means they know everything.
Dr. Sarkar, I have a question.
Okay.
Looks like people have questions now.
All right, I'm ready. We can answer.
Okay, I have a question.
Sure.
For someone who has unilateral kind of pulsatile tinnitus doing inversions, what would be your recommendations?
My recommendation will be, why do you want to do inversion?
I mean, this part of just the yoga that
You have a
doing
tinnitus. Why do you want to do inversion? Let me ask you why.
to relax.
Relax. First, for the tinnitus, you do a Brahmari Pranayam.
No, it's a no, my question was, should we tell them not to do it or continue?
No, don't do anything. There is every contraindication. If you look at all the contraindication, you will be not able to do anything.
Correct.
Okay, I have a diabetes, I have a hypertension, I have a heart disease, don't do this, don't do that. No, you listen to your body signal. I have unilateral tinnitus. First, I start doing a Brahmari Pranayam. Why? Brahmari Pranayam has a frequency, tinnitus has a frequency, it's going to cancel. Slowly and slowly you will see tinnitus will get better. When you get tinnitus will better, what asana you want to do? You want to do inversion asanas? Do the inversion asanas. How do? You do the inversion, put your head down. Put your head down, then listen to your body signal. What is your body signal? You can talk, you can breathe, you're no flashing in your face, your eyes doesn't have any watering. So by the time you come to that state, you will see automatically you will do your inversion asanas. So we have a heart disease, we have a serious cervical issues. So if I say I don't want to do anything, I will never get over all these conditions.
Right.
In steps, and it is different for every person. That's why you have to listen to your body.
Mrs. Mohan, I have a question on I have a knee problem,
Yes.
and it seems like due to cartilage, it's restricting me from a lot of things. Any suggestions?
Any very simple, any structural issue in the body is not going to kill you. I have a cartilage issue. I have a torn cartilage in my knee. That knee is going to cause me a pain. So why the pain? Pain is not due to the cartilage. Remember, this cartilage, which is covering the bone, cartilage doesn't have any pain file. What it does when the bone is rubbing against the bone, our body does what is called a splinting. Splinting means it tightens my ligament, tightens my muscle, try to keep my knee joint immobile. So what you need to do, the best way to do it, that you find a position where you can put your knee. Suppose you can put your knee here, and it is a little short of pain. You do a little Bhastrika Pranayama on this posture. See, our Bhastrika Pranayama, see how effortless it is. Why it is so effortless? Because we practice every single day. Practice every single day with the Bhastrika Pranayama, we get into in this state. So I have back problem, knee problem, neck problem. I have all kinds of bones and joints problems. So if I don't do anything, I have a frozen shoulder. I have a pain. What I do? Close my eyes, follow my breath. And if it is pain here, I do little less. From here, I do slowly, I rotate my shoulder. And it will happen. If I have a neck pain, I have a neck pain, I find a posture where there is a pain. We just want to turn down this light.
Right.
So when you have that place where you don't have any pain, you even keep on staying in this position. You do exhalation longer than inhalation. Remember, this is, we have a lot of scientists here, a lot of pharmacologists, biologists. It's called anaerobic glycolysis. Aerobic glycolysis is a pure eighth grade chemistry. Your end product of metabolism is glucose. Glucose combines with oxygen, forms carbon dioxide, water, and ATP. ATP is energy, adenosine triphosphate. If you don't have enough oxygen, glucose combines with oxygen. It is called anaerobic glycolysis. It produces lactic acid, pyruvic acid, pain-producing substances. And very simple, like I can give an example. You are not prepared, you are running. You're running today, you did not pay attention to your breath. What happens tomorrow? You get a pain. Where do you get a pain? Pain in the muscles. Why? Because you were ahead of your breath. You did not have enough oxygen. You develop anaerobic glycolysis. You develop lactic acid. That lactic acid causes the pain. So do the breathing, and especially when I do it primary myself with the therapy for the bones and joints, I put the bones and joints in that posture like I will do it even in a chair. I'll sit down in a chair. It will show you how beautiful it is for a knee joint problem. I will take a chair. I'll take my leg. I will take this leg and slowly I will wrap as much as you can. If you can wrap all around, if you can see me, I'm wrapping around, I'm sitting down. And I can do my breathing. I can do my exhalation longer than inhalation. I can do a little Bhastrika Pranayama, sitting like this. I can do. These are wonderful practices which comes with you. And as I said, It's a 99% practice and 1% theory. More and more you do. You see, Shankar guided you with all these practices. And I guided you how to prepare yourself. How to prepare yourself. If you prepare yourself, we'll be able to do all of them.
Dr.
Thank you.
Sarkar, I have one more question.
Sure.
Do you have any in-person CMEs this year?
Pandemic has to be endemic before we do
Okay.
in person. So we really don't know, but we are going to do this year CME virtual again. We'll do a virtual CME. It will be in May. I can give you the dates. It will be in the May 22nd, 23rd, and September 11th and 12th. We'll be continuing medical education, and we'll be doing it for last, 12 years, primarily for healthcare providers. In person, I don't expect it in even 2021. And in-person yoga practice will start probably in 2022.
Okay, thank you.
Welcome.
There's
Yes?
a couple of questions on the chat box.
Okay, what does it say?
Some were asking, they have gotten the sheet explaining different pranayam, but would they have it for asanas? We have the 12 asanas I covered. It has explained basically their benefits, and we have been practicing. I'm not sure what more to give you, but you have pretty much, you have many books on asanas you can pretty much understand. We'll see if there's more notes we can give you. Other question was, which kind of pranayam is better for the memory? Anulom Vilom Pranayam is better for the memory. Then another question was, okay, between asana, I mentioned that if you have a choice between asana and pranayam, do pranayam, and then ask, okay, between pranayam and dhyan. So remember, we are doing asanas, so we can do pranayam or we can do dhyan. Ultimately, our aim is to do dhyan, meditation, samadhi. But without the fitness of your body, really, you won't be able to successful in doing pranayam or dhyan. So you gotta take care of all of them. You know, you gotta start saving 2-3 hours of your time every day for these programs. Health is your most important aspect of the life. You know, the says Mool Adhar of our life is Dharma, Artha, Kama, Moksha. You know, that Dharam Purvak, following the righteous path, you do your earnings, and with those righteous earnings, you do your desires, you fulfill your righteous desire with those righteous earnings, and that will lead you to the moksha. And for that, for all of that, is you need a good health. So good health is the primary base of achieving anything in the life. So let's not start shortcutting it. Look at the overall, you know, it's like I said, you cannot do dhyan unless you have a really a good healthy body, and then translates into good healthy mind, which pranayam going to give you. But definitely our ultimate goal is dhyan. Dhyan is a higher than pranayam, and pranayam is a higher step than the asanas, but they all are needed.
Shankar,
Yeah.
why don't you take out my spotlight so that you can come to a gallery view, you can see everybody.
That's okay.
No, just you know, so you can see people who can take out the
Yeah, I've taken out the spotlight now.
yeah, and you can do it in a gallery view so you can see everybody. So any other questions from anybody?
Yeah, Dr. G, if you can explain that what we can do for reducing the throat tonsils and stones. And
Most
you
people-
have already explained the sleep apnea, the problem.
Yeah, primary
Explaining the Ujjayi Pranayam. So
Yeah,
can you please elaborate?
primary therapy is the Ujjayi Pranayam. You know, when you do the more Ujjayi Pranayam, anything, remember, the whole yoga practice is, I showed in the anatomy, is massaging the organ and massaging the site. So even if you have a thyroid gland issue, so look at that. When I'm doing Ujjayi Pranayam, it massages your thyroid. Same way it massages your, remember we said, it comes from a hypoglossal nerve and a glossopharyngeal nerve. It tightens up your soft palate. And then the other practice is your Singhasana. Singhasana, Hasasana. We'll do it at the finish, at the time. We have not done today, maybe Shankar will do it tomorrow. So when you do a Singhasana, it could do all different. Very good for your tonsil, very good for your throat. But Ujjayi Pranayam, but you have to do it very in a relaxed way, the Ujjayi Pranayam. Okay? What else? Thank you for the question.
We have enough of the day today, 12 hours. We have most of the people are with us.
What 12 hours? So who had 12 hours? Generally, we practice 24 hours, so.
Yeah, it's a wonderful day, 7 to 7. And we are looking forward for tomorrow. Again, please do join before time. We will start right at 7 o'clock. And it's going to be amazing as it was today. And you get to grasp many more things what we have talked about as you hit same things from different angles and many new things. And you will, I'm sure you will gain a lot as we have the experience for many other workshops. There are a couple of questions.
Yeah, 7 o'clock Central, 8 o'clock Eastern.
Yes, please. Sorry about that.
Just to remind.
And 5 o'clock Pacific.
Oh, yeah. If somebody, 5 o'clock Pacific. Oh, that's early for Pacific, but yeah.
It's not early for a yogi. I never wake up later than 4 o'clock. I'll just give you an example. Yes, early to bed, early to rise makes the man.
Healthy and wise.
There you go. So it's a very important that we do right kind of food, right kind of thoughts, and nidra is also, nidra, right kind of sleep. So those are disciplines. We should observe the right disciplines if we really want to achieve something in the life.
Like Mr. Modi, he sleeps only 3-4 hours, and he says, "I am good. I am good."
Yeah, definitely. The yogi can sleep 3-4 hours and have complete. You get a deep sleep, and you don't need 8 hours.
Yeah, but in Western philosophy they don't know, because they don't do yoga, so they say 8 to 9 hours. 8 to 9 hours.
Yeah, I have read articles on the Western philosophy recently also. What lack of sleep does, basically without 6, 7, 8 hours, and I was concerned about it. Actually, I don't sleep probably 4.5 hours.
Okay.
And I talked to Swamis who've been doing yoga, and they know all these shastras, they do upasanas. And he says, yes, I understand what the Western science says, but we yogis, we are fine. And also I bought a watch to watch my score. And I find that I score much higher in 4 hours of sleep than other people score in 7, 8 hours.
That's good.
The quality of the sleep is, when you do pranayama, when your thought process is right, you get a sound sleep and you recover. I'm as healthy as any can be,
So I remember I explained to you when I presented, I also talk to Shankar all the time. You have 2 kinds of sleep: REM sleep, or rapid eye movement sleep, and non-REM sleep, non-rapid eye movement. Rapid eye movement, your mind is still active. Non-REM sleep, there are 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 and 2 is almost 50%, and stage 3 and 4 is the sleep, which is a deep sleep, which is almost like you remember Jagroto, Shapno, Supto, Turiya. Awake, dream, sleep, your superconscious deep sleep. So you yogis with their relaxation practice, they're always throughout the whole day is stage 1 and stage 2 of non-REM sleep. So they only need a stage 3 and 4. And it doesn't need to be more than even 2 hours. Bodhi sleeps what? 4 hours, you say 3 hours? Indira Gandhi used to sleep only 2 hours. Yeah, and Indira Gandhi was functioning all the time. So you need basically just to get into that a deep sleep. Shankar has a Fitbit which records his deep sleep, so he knows how much deep sleep he gets, and that gives a percentage of the deep sleep. All of our trackers, this trackers gives you the sleep, how much sleep you get.
Okay. And you know what? In Western philosophy, they say get up and have a heavy breakfast. But yeah, they don't do any exercise, any in the morning. They just go and eat. And
You will tomorrow we'll talk about, you'll see the morning is a kapha time. Kapha is called a manda agni. So in yogic tradition, breakfast is very light. Very little breakfast. Eat your lunch, that is your pitta time. Even dinner time is also very small. And we'll talk about all these tomorrow.
Diet, yeah.
I make a comment here, very interesting how the Western world distort these things. As you have heard, the breakfast should be like a king. Okay, what does king do? Does king eats that much? No. He finds very nutritious meals. He only eats very little. So the right thing in the morning, eat like a king. Be very selective and very nutritious food. And that should be your breakfast. So that it has distorted, the saying is right, but Western world has distorted this biggest meal to be the breakfast. That's not so. All the nuts and nutritious food is in a small quantity. Concentrated food is eaten at the time of the breakfast. Our biggest meal is our lunch. And dinner should be like the beggar. The prince, eat like a prince in the lunchtime. Yes, he is hungry, he is young, he has full, you get a full meal there. And eat like a beggar in the evening. Means you can't afford much. So always have a healthy mood, but very less quantity in the evening. We'll talk about that health tomorrow.
Yeah, thank you so much. So let's bye everybody.
I have a question.
Okay, last question. so everybody can leave, please. Yeah, we will have. Yes, go ahead.
So why do we get lethargic in the afternoons? Because of course, we're saying we should eat big meal in the daytime, and a lot of times after the big meal, we get lethargic and feel sleepy, right? Which is why Western suggests to eat less in the afternoon so you can stay active, right?
Okay.
Let me explain.
Okay, go ahead.
Let me explain to you very simply. It is nothing to do with your food. Remember one thing. When you have a strong Agni, we say you digest any food. It's not the food what makes your body. Food has to be digested. When you feel lethargic, when you feel sleepy, all this time, this is called your sleep apnea. You did not have enough sleep at night. Daytime sleepiness, daytime lethargy is a sign of your sleep apnea, which you really don't know, don't record it, because you are sleeping 6 hours, 8 hours. And unless you do a sleep study, you will never know it. So a daytime sleepiness, daytime lethargy, don't blaming on your food, don't blaming on your activities. It is purely a lack of good night's sleep. It is fine. Because, for us, when we are practicing, we're doing everything. I'm from Bengal, and in Bengal, everybody says, look at this person, how strong the person is. You know what the strong person is? In Bengali, it's said, loha khe hajam kare. That means they can eat a piece of steel and can digest. digestive power, Jathar Agni. We do a big, we do all Kapalbhati Pranayama. Why the Kapalbhati Pranayama is helping you? It is called Agni Pradhan Pranayama. It ignites your Agni. Tomorrow we'll talk about Agni. There are 40 kinds of Agnis we have in our body. Pancreas has an Agni, liver has an Agni. So in a yoga practice, what will happen to you? You will be energized at battery. Wake up like Shankar, like me, at 4 o'clock in the morning, and you'll be up whole day. No sign of any lethargy, no sign of any daytime sleepiness. You will go to bed very well refreshed and wake up very refreshed. I think we're getting in there. You guys need to go. Huh?
Good, everyone. Great. Thanks for be the participants, and it's good. Let's have a great meal and sleep well. And we'll see you. Namaste.
Namaste.
Thank you.
Namaste. See you tomorrow.
Shubh Ratri. Good night.
Shubh Ratri.
Okay.
Namaste, everybody.
Namaste.
Yeah.
Thank you, Dilip ji and Shankar.
Thank you.
You're welcome.
I think.
Leave. One more time.
Okay, Shankar,
Yeah.
you give me a call when you finish this. I want to
Okay.
talk to you for a minute.
Yeah. All right. I'm closing the connection. We'll see you tomorrow. Thank you.